Okay, welcome everyone. Welcome to our second session of the Building Healthy Brains series with Dr. Irving Vega. This session, of course, being Building a Fit Brain. And as a means of introduction, Dr. Vega is the Associate Professor of Translational Neuroscience at Michigan State University. And before coming to MSU, Dr. Vega studied biology at the University of Puerto Rico and gained his PhD in cell biology and neuroscience at Rutgers. His studies also included a postdoctoral fellowship in neuroscience at the Mayo Clinic of Jacksonville. And today, he's going to teach us how to build our brains in midlife. So thank you very much, Dr. Vega. We really appreciate having you. And one piece of housekeeping that I do have is that we actually, the organization that Dr. Vega represents, the MCC-FAD, does a lot of research in Alzheimer's and dementia, and they have a registry for research in those areas, which I will share with everyone now. So just click on that, and it will take you to the survey that will allow you to register with their pool of applicants, and you can help further Alzheimer's and dementia research far into the future. So again, thank you very much, Dr. Vega, for being here, and take it away.
Thank you, Steve, for that kind of introduction. And I will, what just Steve mentioned, I will give more details as we go into the presentation and at the end of the presentation. I'm glad to be here today to talk to you about building a fit brain, the means of a healthy life. It is really important that we take care of our brain as soon as possible, as early as possible, and not start to worry about our brain when we are older in those golden ages. We need to, in order to have a fit brain for those ages, we need to start now. So today, I'm gonna put in perspective why it's important to keep a healthy brain. And we're gonna talk a little bit about the basis of Alzheimer's disease and related dementias. And then what are those risk factors associated with Alzheimer's disease and related dementias, which is the things that we need to avoid in order to increase our risk of developing these terrible diseases. And then some suggestions on what we can do, how to build that fit brains that we need to reduce the risk of Alzheimer's disease and related dementias. So to start, I want to just give you a definition of about dementia. Dementia is an umbrella term that just indicates that something is wrong in your brain. It's not a specific disease. It's just a collection of symptoms that affects your reasoning, your cognition, your executive function, meaning making decisions in daily life living. So dementia is a general term, not a disease. The diseases are actually, are the dementias, for example, in the brain disease, the dementias that we know, the diseases are frontotemporal dementia, Alzheimer's disease, Lewy body, dementia with Lewy body, and vascular dementia. Being Alzheimer's disease, the most prevalent type of dementia, the best known and the most studied one, because as I just mentioned, it's the most prevalent one. About 60% of people suffering of these symptoms, of this collection of symptoms that we refer as dementia, have Alzheimer's disease. The second most popular one is vascular dementia. And there is an interrelationship between vascular dementia and Alzheimer's disease. It's very rare to have only Alzheimer's disease. Usually you have Alzheimer's disease with components of the vasculature in the brain being affected as well, in a mix of vascular dementia and Alzheimer's disease. So these two diseases that are encompass the 80% of the dementias has some overlapping symptomatology and some overlapping pathological insults that leads to the presentation of the symptoms that we call dementia. So these two diseases are the most prevalent one. So that being said, Alzheimer disease is a progressive, is we call it neurodegenerative because it's continue with different along years on how the disease progress, how I should say how the pathological process. Let's make the distinction between the disease and the pathological process, because the pathological process, I will show you a graphic soon, very soon, starts before the symptoms are presented, before the disease is presented. So the Alzheimer disease and vascular dementia, but in this case, I'm showing here the progression of Alzheimer disease, start in a specific brain regions that are associated with our capacity for learning and memory. And it's there where our short-term memory is actually a process in our brain, and this is the limbic system where the hippocampus, for example, is present. And I'm not going to go into too much details of the anatomy, just to let you know as a reference that the temporal lobe, and particularly the limbic system, is the the areas that are early affected in the pathological process that leads to Alzheimer disease. And one of the linking the pathology to the clinical presentation, early on, one of the best first symptoms of clinical complaints of people that later on are diagnosed with probable or possible Alzheimer disease is that they forget, for example, what day is today, or the name of start repeating questions because they forgot that they asked already that question or talk to you about something specific. So that short-term memory, that specific working memory, is the one is typically the first symptoms because affects that region that deals with the processing of working memory or early stage memory. Uh, so that's why those symptoms are presented first. Then the pathological process continue affecting other brain regions, and then that the clinical presentation then is problems with reasoning, making decisions, orientation, movement, and then until it gets into all different areas in the brain, especially the cortical region where the memories are. So this region here, in the neocortex, is actually where our memory, long-term memory, are stored, and is where the person living with Alzheimer disease type dementia will start losing the memory of the name of wife, uh, children's, the daughter, sons, brothers, sisters, is going to start forgetting that kind of information, long-term information, when the pathology then reach these areas, these cortical regions that store that information. So first is short-term memory, and then later on is long-term memory, the one that is affected. And what you can see here is what the pathological process does to the brain. You have a normal brain here, and then you have an Alzheimer disease brain here. You can see how the contortions, what we call the gyruses and the sulci in the brain. These are the gyruses, and these are the sulci. The sulci get white, and then the gyruses get thinner, and it's because of all that neuronal loss. Neurons are the cells in the brain that carry the information that lead us to learning and memory, for example. So those cells start dying, and you can see a massive loss of cells and material of the brain when you compare an Alzheimer brain versus a normal brain. And the two culprits that leads to this pathological process are what we know as amyloid plaques, that is an aggregate of a peptide or a protein peptide that is aggregated in the extracellular space, meaning in the outside of the cells in the brain, and another protein aggregate that is called neurofluoride tangles that is inside the cells. And if you want to go into, you have questions about them and you want more details about it, I will be happy to go in the question and answer section. We can go in more detail. For now, it's sufficient to say that these two pathological hallmarks have to be present in order to diagnose the individual as an Alzheimer's disease. And that takes place post-mortem. That takes place after the person dies, that definitive Alzheimer's disease diagnosis can be reached. In the clinic, because of the symptomatology and the advances in research, that clinical presentation leads to a diagnosis of possible or probable Alzheimer's disease based on how those symptoms are presented. But it's not definitive. Unfortunately, right now, the only definitive diagnosis tool that we have is a pathological characterization after, post-mortem, after the person died. Uh, but already trained neurologists have about 85 to 90% efficiency in terms and specificity in terms of the diagnosis. But it's very complicated. It can be confused with vascular dementia, and it could be confused by other types of dementias. So we don't have, as I said before, we don't have right now a definitive tool to diagnose Alzheimer's disease, but the clinical presentation and the diagnosis at the differentials in the clinic has been getting better and better, and we can say possible or probable Alzheimer's disease. Alzheimer's disease, as you probably are familiar with, is a disease that presents itself at people that are 65, typically about 65 to 70 years old of age or older, and is as the people as people age, the frequency or the prevalence of Alzheimer's disease, the probability of developing Alzheimer's disease increases. Uh, People that are 85 years of age have at least 50% chance probability of have Alzheimer's disease or being diagnosed with Alzheimer's disease. And because of that, people tend, in my opinion, and that is debatable, it's a debate in the scientific community, associates Alzheimer's disease with aging and indicates that age is a risk factor for developing Alzheimer's disease. And the why in my opinion is not associated directly to age, but to the insults and the way that we uh, fail to prepare our brain is that we get people that are younger that develop Alzheimer's disease, and not all people that are 85 or older develop Alzheimer's disease. We know people that are 90 and 100 years of age that their cognitive capabilities are in good shape. So if associated with age, directly to age, should be affecting everyone. But there are other factors that contribute. Definitely, age. With age, we lost the capability of repair. We lost definitely with age, we lost the capacity to develop new neurons in our brain. So there is a stem cells that differentiate to neurons every time we learn something. Every time we are exposed to a new experience, a stem cell that is present in the brain differentiate into a new neuron. And that is like building muscle. It's like when you do weights that your muscles still grow. That's what happened in terms of analogy. That's what happened when you're learning and maintaining your brain active, that you have more neurons and you have more connections in your brain. So your brain is more robust and have multiple streets, multiple routes to deliver message and to retract messages. So another analogy that I do for a robust brain is a city with a lot of streets that connect each other. So if you cross in Michigan, for example, that we have the winter season and the construction season that we're getting into right now. During the construction season in Michigan, when one street is closed, we have others. So the more robust that interconnection is, the more choices we have to get into the destination that we want to arrive. But as if we have less streets and they close those, then it's going to be more difficult. So in the brain, the more we challenge ourselves, the more we learn new things, the more we keep our brain active, the more connections, the more neurons we have, the more prepared the brain is to deal with the deficiencies that accumulate to age. Something that you can see here too is that it differentially affects people of different ethnicities. So African Americans and Hispanics, Latinos are more affected by Alzheimer's disease than non-Hispanics whites. So, and that is something that is related mostly not to genetics, not to the word that is used in the census as race. Is more about social determinants of health, how we prepare, how health disparities in other diseases make some people more vulnerable to develop Alzheimer's disease and other dementias compared to others. So during the process, as I mentioned before, the disease is progressive. So you start with few symptoms that start between, can last between 3 and 7 years. Then you start getting some cognitive impairment, and then that cognitive impairment stage, if you will, can go between 2 and 4 years, then transition to a more moderate type of dementia between 3 and 8 years, and then it goes into more severe stages. So from diagnosis to death, an individual can live with the disease for 20 plus years, but that varies between individual to from individual. Some people from diagnosed to death is probably 3 to 5 years, where other was go from 20 to 25 years. So it depends on the individual, other complication, comorbidities, other disease that the individual may have. But what I wanted to draw the attention today, and the topic of this seminar today, is this area. We know now that the pathological process, it can start 10 to 20 years before clinical presentation. And there's some evidence, even though it's controversial, that it can go even back to 30 years before clinical presentation. What that means is that if someone developed the disease at 65 years of age, presents the disease, the symptoms associated with Alzheimer's disease or other type of dementias at 65 years of age, that means that the pathological process perhaps started when they were in their 40s, the mid 40s, like 45. Okay, at that age, uh, we don't tend to see Alzheimer's disease as something that is affecting us, that will affect us, that is doesn't have to do anything with us, right? Uh, but what the data is saying is that the pathological process are starting that early, but because of our brain and the construction of the brain is so plastic, and it can adapt and it can repair, it masks the presentation of symptoms. So when you have a street that is closed, you go and take the other street and reach your destination. That means that you have another way to retract the same memory. So, but however, when the streets start closing during time, then it gets to a point that you cannot retract that memory, or you cannot reach your destination, right? So that's when clinical presentation takes place. So we should then be aware that that we can do something to perhaps prevent the transition from the unsymptomatic, the preclinical stage, to the symptomatic stage. So we can adapt our life to treat our brain like any other muscle. Like we should treat our brain and adapt them and train it and make it fit, like we do when we want to run a 5K, a 10K, or we wanted to maintain in shape. That's the same thing, the same mentality we should do for our brain. The problem is that our uh, way of life and our society, there's a lot of risk outside, right? So in terms of risk factors associated with Alzheimer's disease and related dementias, we have obesity, for example, and that is directly associated with hypertension and this and hyperlipidemia. And those three, we know that in our Western society, there is an epidemic of obesity, actually, even at younger age, in the teenage age. Is because of our diet, unhealthy diet. It's because of the way that has access to McDonald's. I don't want to make them the villains in here, but just high calorie food, uh, food that has a lot of calorie intake. And our sedentary life as well, that we don't do exercise, plus the diet, the Western diet, they combine and that contribute to high obesity. We have, and that unhealthy diet that is here. Then we have a lot of issues with alcohol in our society. Is there social alcohol drinking, and everything in moderation is good. When it goes to these stages where you go and no, I don't drink every day, but then every month or so you drink a lot that you get even unconscious. It's the same as drinking every day. Smoking, we have high incidence of diabetes, especially among African Americans and Latinos, but also among non-Hispanic whites. So all those factors are are understood as risk factors to increase our probability of developing Alzheimer's disease and other type of dementias. Of course, they're protective factors, and the physical activity, the challenge of our brain, that strengthen the connections in the brain associated directly, for example, with education. And that those are areas, and I'm going to go into more detail soon, is areas that actually are gonna fight against these other risk factors. Okay, so healthy living through life versus no healthy living through life is the balance. Is what we need to do uh, to prevent then going through the clinical presentation of dementia, or a type of dementia like Alzheimer's disease or others. But in today, we have another one, another risk factor, which is COVID-19. COVID-19 is in the pandemic, we understood that was a respiratory virus, a virus that affects primarily the respiratory system. But we understand right now that it goes beyond the lungs and directly affect the brain. Although it's still on the debate of whether is actually molecular mechanism directly to the brain or actually indirectly by affecting the oxygenation of the brain. Definitely there is evidence, at least in the laboratories, that the virus that causes COVID-19 can directly kill neurons that are the cells in the brain that I was talking about before. Uh, so COVID-19 actually is well understood right now that it has an effect on the function of the brain. There is loss of smell, loss of taste. There is this what is called brain fog, which actually is that confusion. The person is having problem with memory, and it has been reported that lasts for 6 months after the symptoms ends. And how long that gonna go forward, it just is being studied right now, but definitely has an effect on the brain that we want to be studying for years now. And perhaps in the future, those that survive, and you don't have to reach the hospital to feel these symptoms to the central nervous system. They also affect also is present in people that were not in the ICU or even in the hospital. So we need to understand that better. But right now, what the way we understand it is like having a traumatic brain injury. It's like COVID-19, the virus, is like hitting the brain, similar to TBI, similar to traumatic brain injury. And already biomarkers in the blood associated with TBI, like when you have a concussion, has been also identified in people that suffer from COVID-19. So we understand that TBI or traumatic brain injury, like the football players or the boxers, is actually a risk factor and leads to increased probability of developing Alzheimer's disease or related dementias. So what we should do? What we should do is make right decisions. It's not that we cannot once in a while eat that piece of pizza that we crave about, but not every day. We should be more making healthy choices. And this is the English version, but and these are in Spanish, but this is the perfect. I couldn't find a perfect picture for in English, and this one is perfect because it goes to uh, a message in terms of having a balanced diet for your brain. Okay, so you need to reduce the saturated fats that are in meat, in cheese, in milk, and other type of food that have saturated fat. You should reduce that consumption, the consumption of food that has saturated fats. You should increase fruits and vegetables because they are rich in antioxidants. In the brain, as the brain function, as I hope is happening right now with this information, and for me delivering the information, we generate a lot of energy in our brain that leads to oxidative stress, meaning that affects the chemistry of the brain. And there are natural antioxidants that deal with that. But when you supplement that with a balanced diet, the brains get detox faster. So fruits and vegetables, especially grapes, have a lot of antioxidants. Avocado is another one that has good fat for your brain, and also other vegetables that are rich in antioxidants. But going into fruits, for example, grapes, especially red wine, it has a lot of these antioxidants that are good for your brain. They're called polyphenols, and these polyphenols are in good scavengers of those oxidative radicals that are formed in the brain, and they can take them out really efficiently. But is one glass of wine a day is what is recommended. Not one bottle of of wine is just one glass of wine, and and I should be specific, a small glass of wine, because then you can have a glass that is the size of the bottle. That's not good. It's just one small glass of wine per day will be good. Green tea is being associated with, again, these polyphenols that are antioxidant. If you want to exchange those saturated fat, you should do it by those that are by fat, like the omega-3 that is present in fatty fish like salmon. And then is good to have good carbohydrates like those that are in cereal or in cereals. Those fibers, good fibers as carbohydrate is good for your brain, because the brain only I should say the primary source of energy for the brain is glucose. It's not any other, like other cells in our body can use lipids, can use proteins, uh, but and sugar and glucose. But the brain preferentially use glucose in very specific situation, can use ketone bodies. But mainly the main source of energy for the brain is carbohydrates. So a good diet with good carbohydrates is important. But it has been shown to that calorie restriction is equally important. So if you have a diet that instead of being 2,000 to 2,500 calories per day, you reduce that to 1,500, between 1,500 and 1,900 a day, plus exercise, that actually will be ideal. Calorie restriction has been associated with actually long live people that have that live longer and healthier. Quality of life, quickly, we are in a society that lacks sleep. We are in a sleep society. Is actually is terrible with the problems with sleep that we have, with from apnea to actually not respecting the time that your body is telling you to sleep. And every hour that we lose of sleep is an hour lost. So we need to have a good habit to have that quality of sleep, because when we are sleeping, there's these membranes that open, and those toxics that accumulate during the day are flushed out of our brain. When we don't sleep well, those toxins that accumulate during the day stay inside our brain, and that continue to do damage to the brain. So quality of sleep means that you go deep in your sleep. Okay, that's deep sleep is the quality of sleep. You have to reach that at least 4 to 5 hours, preferentially up to 7 or 8, depending on the individual and the age of the individual. And if you can have a nap during the day, even better. But I know our society, that's not possible. But again, the important of sleep is to flush the toxic molecules that accumulate during the day that are due to the stress that we have during the day. So reduce stress. One way to reduce stress, other than think positive and do yoga and all that, is doing exercise. Keeping a active life to exercise allow to also eliminate those toxins that accumulate during the day. Socialize, maintain your life connections in life, maintain the interactions. And I know that has been affected during COVID-19, and we have seen how that lack of socialization affects even more those people that are 75 years of older, because of the shutdowns and all that. So that is another topic that goes into a lot of research that says that you need to socialize. Learn something new, challenge yourself, learn a new sport, learn a new language, learn a new game, board game, a new skill. That actually doesn't, you don't have to be perfect. Just the process of learning, just the process of being involved and thinking about it, that will activate your neurons in your brain. You will create more connections. You will develop more neurons. So basically, the quality of life is actually to be relaxed, to try to keep your life together in a way that you can, we cannot get away of stress, but we need to deal with it in a healthy way, by doing exercise, by rest, sleep well, socialize, and challenge our brain continuously. So with that, I think I've run a little bit over time. I want to say that all this information is actually due to research. And the reason why research is important is to better understand how the pathological process go from being a pathological process with no symptom to symptoms. And for that, we need everyone. We need everyone involved. And unfortunately, especially Latinos and African American don't participate in clinical research. And we want to, through this survey, we want to keep you in this directory, not to participate in research, but to give you information about potential clinical trials that you may be able to participate. And in that way, we can increase our knowledge about that. You don't have to have Alzheimer's disease. We wanted to understand those people before they develop the disease, how we can keep it. You can have the pathological process, but how we can stop from clinical to get to clinical presentation. So that's why everyone is important. And if you can fill that survey, that will allow us to reach out with information about potential clinical trials that you may be able to participate. And with that, I will be happy to answer any question that you may have.
Well, thank you, Dr. Vega. That was an excellent presentation. It looks like we do have a question from Barb Wingard, and she says, you mentioned the effect of COVID on the brain. Are they finding that the viruses may cause viruses may cause Alzheimer's? That's something I've heard as well.
Yes. Well, it has been associated recently in the past 3 to 4 years with herpes virus, herpes simple virus. There is other information about specific bacteria that have been associated also with an increased probability of Alzheimer's disease and related dementia, like H. pylori, the one that induces ulcers in the stomach. And the association between these two virus and bacteria is, in terms of this biosis, this regulation of the population of these bacteria, is that they can induce neuroinflammation in the brain. So the inflammatory response in the brain, and we actually, in my lab, I have a grant trying to study that process of how bacteria can actually induce or be directly associated with the pathology associated with Alzheimer's disease. So I'm really interested in that area. And the aspect is the connection at the molecular level between neuroinflammation and the pathological process associated with Alzheimer's disease. And the same thing goes with COVID-19. With COVID-19, you have an inflammatory response. And that inflammatory response at some point for us is protective. But if it skips that signal, it start affecting what is normal in the brain. And it start killing everything, regardless if it was the affected one, it's also start to affect the healthy areas as well.
Okay, thank you for that. And then the next question from one of our patrons is, do people who suffer from Alzheimer's also suffer from epilepsy, or does epilepsy increase your risk of Alzheimer's?
In terms of the direct risk for Alzheimer's disease, I haven't seen anything related to directly being epileptic and being a high increased chance of Alzheimer's disease. That being said, is depending on the severity of the epilepsy of that individual and how many this individual may have in the future. That again is associated with inflammation. And a lot of people are trying to study how inflammation is directly linked to Alzheimer's disease and related dementias. So any insult, epilepsy, concussion, like trauma, brain injury in a car accident, because you fall, you play soccer or you play football, and you have these subconcussive insults that you don't have concussion but are subconcussive repeatedly. All those aspects will increase your risk, and it will depend on how you then balance that with a healthy living to repair the damage that is done.
Okay, thank you. And I think the last question we have is, what works best for generalized anxiety disorder? Or do you have any recommendations as a neuroscientist for ways to mitigate that kind of a disease?
First of all, I'm a neuroscientist. Mm-hmm. So my recommendation will be to go to a neuropsychologist or a neurologist. That will be the people more prepared to try to answer that type of question. But because anxiety and anxiety disorders are two different things. For anxiety, with exercise, we're trying to find the trigger that induced that anxiety event, to try to identify what is that environmental factor that is contributing to the anxiety. And again, exercise, healthy living, and quality of sleep will reduce anxiety. Anxiety disorder, in terms of the disease, will require then will require medical intervention. Will require then, it could be due to a chemical imbalance in the brain, and that would require then medication. So I want to create the distinction between anxiety as we suffer in our daily life because we are in a very stressful situation, especially now with the COVID-19, the kids, the economy, food security, health security, job security, all that. That can be mitigated by quality sleep, exercise, and identify the triggers so that we can process that. The disease, anxiety disorder, will require a clinician to help you out to identify what is the chemical imbalance that you have that is inducing the disease. You are on mute, Stephen.
I'm on mute because unfortunately our closing music is playing. So it looks like that's all the time we have. We do have to prepare for our next session. So I would like to thank you all for coming. And again, thank you so much, Dr. Vega. I think we all got a lot out of this session, and we're really happy to have you here at the Grand Rapids Public Library. So thank you very much.
Thank you very much. Bye.
Bye-bye.